RX system, as well as an Amazon bestseller. I'm here to help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. Well, welcome today. Our title is Gorgeous Summer Skin Tips on Preventing Skin Cancer. And I have a guest with me, Dr. Katisha Vance. Hello, Dr. Katisha. How are you doing?
Hey, Dr. Sonya, how are you?
I'm wonderful. Thank you for joining me today.
Good, it's my pleasure. I've been looking forward to it.
Good. Well, I'm going to have you to introduce yourself to our audience.
Okay, all right. Well, I am Dr. Katisha Vance. I'm a triple board certified internist, hematologist, and medical oncologist. I am also a best selling author, consultant, and speaker. And I work very hard to help cancer patients and their families learn how to navigate a new cancer diagnosis.
Well, thank you. Thank you. Well, today, like I said, our topic is concerning gorgeous summer skin. And our goal today is to give you tips on how to prevent skin cancers and what you need to do to one recognize any type of cancer, but also what to do about it. And we're going to give you some statistics, on the difference between skin types, so you can take that into consideration also. And we came about this topic because even though we're, quarantined indoors because of COVID-19, we do know the sun is coming, and really in a lot of places it's already here. It's beautiful outside actually. And so in some places it's been sunny for about a month, if not 2 months. But definitely, we will be getting out of our houses soon. The orders for various states will be slowly, allowing people to leave their homes so they can resume their daily life. But regardless, we want to just make sure you don't forget that when you are able to go out and enjoy the sun as what you used to doing, that you remember the few tips on what you want to do to prevent skin cancers, but also just to take care of your skin so you can have that glowy skin that we all want to achieve. So great. Well, Dr. Vance, with that being said, what do you find as some risk factors for skin cancer?
So, in general, what we have talked about and what we've known for years is that people who have had multiple skin burns, sunburns over their lifetime are at increased risk for developing skin cancer. So, you think about the person who has spent a great deal of time at beaches over their lifetime, people who have made deliberate attempts to tan, whether that's outside or in tanning beds. We know that all of those people put themselves at increased risk for developing skin cancer. I think that our state governments have done a really good job at trying to educate people about the dangers, in particular, of tanning beds, or even some countries where they are outlawed, thankfully. But at least people are being made aware that sun exposure and UV light exposure increases your risk for developing skin cancer.
No, you're right. Definitely. We do know about the sun, and unfortunately, it's correlated with, how many sunburns you have,
Right.
So definitely anywhere from 1 to 5 can increase your risk for squamous cell, basal cell, as well as melanoma.
That's
and
right.
those are our major common skin cancers.
Yeah.
Of course, there's other skin cancers that can affect the skin, but those are the ones people usually are talking about.
Yeah.
But I agree with you, definitely the tanning beds. And some of that is because, number one, you stay in there too long, but also what is found that tanning salons may change your light bulbs differently, in which that you may go in there, have this preconceived setting that you've been using for a while, and sure enough, they change the light bulbs, and then sure enough, it's more output than what you're used to, receiving. And so that can lead to a sunburn, a burn rather, not a sunburn, but a burn. But also
Right.
more ultraviolet intake into your skin, and therefore increasing your risk for developing the skin cancer in the future. So I definitely agree with you on that. And that's really common for our Caucasian population. for our non-Caucasian, our ethnic skin population, a lot of times the skin cancers are not in areas of sun exposure. They're in, that's what I've seen over and over again. They're in areas where you least expect it, where there's not a lot of sun.
That is
And
very true.
yeah, and so, for instance, I saw one patient, she had a lesion in the back of her scalp, and I mean the lower back where you don't get sun, not at the top. And she had a head full of hair, very thick, coarse, beautiful hair. And sure enough, looking at it, it looked like a bump that needed to be taken off. But she said she didn't even complain of bleeding. She didn't know if it was bleeding or anything. But we did a biopsy and it came back a basal cell in her scalp, a head full of hair, ethnic skin individual.
And so, unfortunately, unfortunately, you will get the right.
And so then another commonplace, one person I've seen.
And so, unfortunately, you will get the.
You would get what? I'm sorry. Dr. Katisha? You know what? We have technical difficulties. Everybody know. Everybody's on the internet. And so that's what we're dealing with. But you were saying something, Dr. Katisha. I'm sorry, because I had a stall there.
Yes, I think we did. Yeah, I'm back with you now, though.
Okay, good. Okay. What were you saying?
So I was saying that it is really unfortunate that you get these skin cancers in areas that people can't see. One of the things that I think is so important is for physicians and other practitioners to recognize that, because many times, especially when you're talking about ethnic populations, they don't get full skin exams like other patients do. And so I've had patients who've come in because their barber or hairstylist has noticed an unusual lesion. I've had people come in because they themselves have noticed things on the palms of their hands or the soles of their feet. There have been podiatrists who've picked up these things on their exams. And then you'll have people who will go to the nail salon and they will have the nail tech who will notice a lesion in the nail bed, either of the hands or the feet. And so these are very important things that people need to know about. These are areas where you can get skin cancer in non-sun exposed areas. And so I encourage people, you have to look for these changes in your skin. Even if you're someone who's never had a lot of sunburns in your lifetime, you've got to check out your skin and look for areas that are new or changing, or maybe they just look different than the other moles that you have.
Yeah. And you're right. We've seen that. And then like you were talking about some of the, and this goes along with, besides the appearance, goes along with what is the, what made people, like you said, what they look for, the appearance of it, but definitely if you have an area where you have continuous trauma, there's a chance that you can get a squamous cell there, So definitely, like you mentioned, areas that are non-healing or repeated trauma. And like you mentioned, the sun exposure, those are risk factors, the tanning beds you mentioned. And I agree with you. And then sometimes it just happens, unfortunately, and that's not even a risk factor. That's just living, unfortunately.
Right. And we know that genetics will play a part in that. So a part of what I do now for many patients who present with melanoma, even if they have a history of multiple sunburns, we still do a very thorough genetic workup to see if there are genetic mutations involved with their skin cancer, in particular melanoma. And the reason this is so important is that it allows us to hopefully be able to give targeted therapy for their treatment.
Yeah, and you're correct. Definitely. Thank you for that. Now, so we were talking about the appearance. We mentioned, like you said, non-healing area. What I found, basal cells, when we read about basal cells, for instance, which is the most common skin cancer there is, we hear the pearly papule. And someone asks, what does that really mean? And a pearly papule is when you can look at it and it looks like a little jello almost. And in a sense that it's clear, you can see right through it. You can see to the bottom almost, but it's a bump. So it looks translucent. And sometimes you can see a little blood vessel on the surface. And when you have that, Yes, or it can have rolled borders. We call it rodent ulcer, which the center is the ulcer, but on the edges it's a border. Like
Mhm.
what do you call those? Is it a bunt cake? You know how the edges are
Yeah,
rolled when you turn it upside down, but
yeah,
it's translucent, and of course any size. And then there's, that's the common presentation, but in ethnic skin individuals, you don't see those
you don't
characteristics.
see that. You don't.
No,
And
not at all.
very often, those lesions will still be pigmented rather than that pearly, translucent lesion. So, you and I have had a discussion before about the lack of ethnic atlases for pathology related to dark skin. And so that is something, unfortunately, that is just not available. And it probably comes with years of experience and seeing these lesions in people with ethnic skin and knowing that it just looks a little different. But it's
Exactly.
just so important for us to let people know that the things that you may read about
Mhm.
commonly don't necessarily apply to brown skin.
Exactly.
Yeah.
And the second most common is the squamous cell.
Hmm.
And squamous cell, on Caucasian skin, sometimes it's red, but definitely you have a non-healing area.
Right.
So if and this is what I tell any patients, when you have a lesion on your skin and you don't know what it is, and it's just came up, it's not something you've had since birth, but it just developed and you're not for sure what it is, this is when you need to go see a professional to
Hmm.
get a diagnosis to make sure it's nothing serious.
Yeah.
You should be able to look at your body at least once a month, a good inventory of yourself, take a good look,
Hmm.
and make sure you can account for everything on your body. And
Right.
so, if you cannot, that's again, this is like you mentioned, a skin examination. This is what people need to do. Go get their body examined by a doctor. We see doctors for GYN exams, for colorectal exams, for their colonoscopy when they hit 50. We see go to, if you have a heart problem or blood pressure, we need to do the same for the skin,
That's
get that
exactly right.
examined too.
Yeah.
So, but definitely when you have a lesion that is not healing, something that's continuously bleeding when you hit it,
Hmm.
that needs to be looked at
Yeah.
and make
And I think the important thing that you said is if somebody asks the question, what is that?
sure.
Then you need to have a doctor look at it because that is the time when I've most often had patients to discover a skin cancer when a spouse has seen something that is new and they've said to their significant other, what is that? Then that
Mhm.
means you need to go and see somebody. The
Right.
other thing that's so important, I've had patients who'll say, I've had this thing on my head and I scratch it off and then it comes right back. And I scratch it
Mhm.
off and it keeps coming right back. That is a lesion that you need to have evaluated, something that keeps coming back over and over. The
Mhm.
other thing that I think is so important to emphasize is that when we're talking about basal cell and squamous cell
Mhm.
cancers of the skin,
Mhm.
they are usually local cancers. And so they don't spread to other parts of the body. And so that's important because sometimes when people hear cancer, they automatically think, oh my gosh, this is some terrible thing. And it is bad, don't get me wrong. But they don't want to come and see a doctor because of fear that somebody's going to say, oh, you're going to have to do months and months of chemotherapy, or you're going to have to do this treatment or that treatment. When in fact, with basal cell and squamous cell cancers that are caught early, 99 to 100% of those are going to be cured with just local treatment. That is, having a dermatologist or a surgeon or a plastic surgeon go in and
Mhm.
remove that area locally. And then you just need to be followed very, very closely. So,
Exactly.
yeah, you have to take away the fear about this. And all cancers are not created equal.
Right, and you're absolutely correct when you're talking about the longer you've had a squamous cell, and it's a little more to it. But you're right. Once if you didn't have it that long, and you get it removed, and we catch it early,
Hmm.
yes, absolutely. But when they've had it for a long time, that's the problem.
Yes.
And unfortunately, like melanoma, squamous cells can spread through the body because these are the same cells as on our mucosal area. Like when you hear about lung cancer or cancer in the mouth, that's squamous cell, and that's the same that's on your skin. And so, but definitely, you're right. If they catch it early, wonderful results.
Yes.
Nothing to worry about. But when you have it for a long time, you know this lesion is
Yeah.
of concern, and you purposely do not go see the doctor,
Yeah.
is you're making it worse.
You are. You are.
You know, with the scarring, with the treatment of it, that means it's either longer if you get radiation there, longer treatment, or if you get it excised, it's a bigger scar.
Right.
So definitely, and then not to mention, if you wait too long, there's the possibility, like melanoma, it can spread through the body, which is not what you want. So again, like you were mentioning, we all want to make sure when there's a lesion on your skin, go get it checked out as soon as
Yeah, get
possible.
checked out.
You
Yes.
know, so yes. Now, some percentages that you found, and we both looked into to share with our audience. You want to say something that you found that what you think would be good for our audience, so they'll know how
Yeah.
serious it is.
So, in talking about skin cancer in
Mhm,
our ethnic populations, I
mhm,
especially want to emphasize that because I think that it is just not emphasized enough. We know that skin cancer only makes up about 1 to 2% of cancers that we see, for example, in African Americans. But what is so important is that even though we have lower rates of skin cancer, we have a worse prognosis when we do develop these cancers. So, for example, if you talk about melanoma, which is the most severe type of skin cancer,
right.
5 year
Mhm,
survival rates for Caucasians is about 95%. For African Americans, 5 year survival is only 65 to 70%. And so a lot of that is about delayed diagnoses, I believe.
mhm.
And perhaps there's some difference in genetics. We don't necessarily know that. But it is clear that even though we have fewer cases of skin cancer, and especially melanoma, we tend to do worse. And so I think it is so important to emphasize the importance of the skin exam. And then it is important to talk about ways that we can lower our risk of getting these cancers, especially the ones in sun exposed areas.
Exactly. Well, I do know here for late stage melanoma, there's 52% in blacks that they don't do well, compared to only 16% in Caucasians and 36% in Hispanics.
Hmm.
So it's definitely a difference. And the problems, when you talk about melanoma, that's a totally different breed
It,
when you talk about skin cancers,
it is.
But, and I say that because, we all have moles. And, but with melanoma, I call it, I look for the ugly duckling when I'm
That's
looking for
right.
it, so you look at the person's entire back, not
Right.
just one mole, unless the mole looks so benign, but when you're not for sure, I tell them, let me look at the entire back if it's on your back.
Yeah.
And I compare it with other moles, and whatever looks the worst, that's the one I'm going after.
Right. The one that
And
stands out.
yeah, that sticks
Yeah.
out, and it works every time. And unfortunately, you can have several on the back or on whatever body part that looks bad.
Yeah.
And you can, sample them and determine, sure enough, you either have melanoma or changes of the mole
Hmm.
that definitely needs to be excised, or you have benign lesions that, or another thing that comes back that really blows, you won't know until you do the biopsy, especially if the person doesn't know their history. If they have a mole that looks really suspicious, either melanoma or mole that's changed, but then it could be a congenital lesion, something they've had since birth.
Right.
And if they don't know that, it looks bad. They all look, a lot of them look really bad, but they are benign.
Yeah.
But
But the
right,
right thing to do is to biopsy those. That is the only way you're going to know what you're dealing with.
exactly.
Yeah.
Exactly. That's
Yeah.
the problem. And so what we look for, like you said, I mentioned the ugly duckling, but we have an acronym that we go by when it comes to melanomas, and it's the ABCDE of melanoma.
Hmm.
A is asymmetrical. We cut it in half. One side does not look like the other. B, borders are irregular.
Hmm.
C, color variation in the
Right.
same mold. And I tell people the brown and reds are fine. The black and blues, I'm going after. And D, the diameter of the mold, larger than the size of a pencil head, which is 6 millimeters. By itself, that's not concerning, but when you have A, B, or C with it, that's
Right.
when I'm concerned. And of course, E, elevation, one part is raised, one part is flat.
Mhm.
And as long as the entire mold is raised, it's okay. But when you have one part raised, one part is flat, that's a concern too.
Right.
So those are just some things that we as doctors go by when we're trying to decide, is this mold we need to do a biopsy on or not? but it definitely is a good guideline for even patients who are checking themselves in the shower or when they look at themselves all over to think about that acronym.
Right.
So,
And even if you forget the acronym,
exactly.
just remember, if you ever say, gosh, this looks different than it used to look,
There
what
you go.
is that? Then go and see doctors like Dr. Johnson so that they can have a look at it. The
Or doc.
worst thing that can happen is Dr. Johnson or another dermatologist can say, oh, this looks fine.
Mhm.
That's the worst thing that can happen.
And a lot of times, what's really good too, another trick that we found that helps is take a picture of it
Hmm.
and compare. So if you have a mole that, especially if you go to a doctor like yourself, Dr. Vance, someone come to you and you just say, not for sure if that's something we need to go after. Let's just follow it.
Right.
Well, you can take a picture. And what I tell people is, okay, so January you take the picture, then February you take another picture, and you compare.
Hmm.
And unfortunately, sometimes moles don't change that fast.
Right.
So then March, you take another picture. Well, don't compare it to February. Compare it to the January picture,
Yes.
you know? And that's what I tell people to do to help, especially if it's on the back and they have a loved one who can watch something
Hmm.
and I'm not worried about a mole that's changing, but it's not enough that I'm going to do a biopsy, but it's definitely suspicious.
Yeah.
So that's what we do too.
Right.
But another thing I found is when we talk about melanomas, melanoma is what makes it worse. And I think, you mentioned this is why the prevalence and the outcome is so bad for ethnic skin. You mentioned it could be genetics, it could be the fact that, medical care, but definitely the location, like on the soles of the feet,
Right.
that's where you find 40%, 30 to 40% of them. And so if a person doesn't look at the bottom of their feet or in between their toes on a daily basis, or at least monthly basis, they won't even notice it,
Right. Right.
So that's a concern. Or is on around the nail of people, how ethnic skin sometimes have discoloration
Hmm.
on the nail, and that's
Right.
normal. But if it's darker or it's something new, then yes, you need to get that examined because that cuticle
You
around
do.
the nail, that skin, if it turns black or just a darker color, you've never had that before, that could be a melanoma there.
Right.
So,
And I've had people convince themselves that somehow they've developed a bruise there, but the bruise doesn't go away for months. And I always say, if there's something there that's present for months at a time and it's abnormal, you've got to talk to your doctor about it.
yes, I
Absolutely
agree
have
with
to do
you.
it.
I
Yeah.
agree. I agree with you.
Yeah.
Um, Anything else on the area of what they need to be looking for? You think we need to discuss, or we could have missed by any chance?
No, I think one of the most important things, especially as we're heading into the summer months, is just to
Mhm.
make sure that people understand the importance of protecting your skin from the sun.
Yes.
And so, yeah, there's so much interest in anti aging. And one of the biggest problems with aging of the skin is the sun. And so,
Mhm.
I think that it's actually quite good that there's so much focus on healthy skin, just like you're doing. When we talk to
Yes.
people about wearing your sunscreen or even doing sunblock, but not
Mhm.
limiting it to that, wearing your big hat if you're going to be outside,
Mhm.
limiting your hours of sun exposure. So 10
Yes.
a.m. to 3 p.m. is when the sun is going to be at its highest.
Right.
And so, if you've got activities planned outside, you need to find a shady spot. You need to have your arms covered,
Mhm.
your face covered. And then the place that most people forget is they forget their eyes. I always encourage people to make sure that they're wearing sunglasses to provide UV protection as well. For my patients who are on chemotherapy, you have an increased risk of getting sunburn. Some of it's because of the chemotherapy. There may be
Right.
some other factors involved with that. Unfortunately, for patients who develop hair loss or alopecia from chemotherapy, you not only have to worry about your usual sun exposed areas, you now have to worry about your scalp. And so
Mhm.
you've got to treat that just like you do the rest of your body. You've got to cover it up and protect it.
You're right. You're exactly right. And the problem with sunblock or sunscreen, a couple of excuses I've heard over the years. Either one is too greasy. Well, let me
Right.
tell you, all these new formulations out there's gels, there's foam. And they're not greasy at all. So that's not an excuse anymore. Number two, it doesn't last long. Well, I can say that's true, but they have some new formulations out. They actually last 80 minutes and they advertise that on the front of the
Hmm.
can. So I tell people when you see that, you need to reapply it every 2 or 3 hours. And then, another one too, what we realize, and I'm sure you've seen this too, is not that people don't use sunscreen, they don't put enough on, or
They
they
don't
don't
put
put
it
it
properly.
on often enough.
Yeah.
So definitely someone explained to me, it's like everybody know how small, I guess, a shot glass or whiskey glass is.
Yeah.
And you fill up that much, and that's how much it takes to cover all over all the sun exposed areas. And another thing too is putting it on often enough. So meaning you want that waterproof or sweat resistant sun block or sunscreen because it lasts longer. But also, as soon as you get out the pool, if you go when we
Yes.
get back to swimming, reapply it.
Yes.
So yes.
Yeah. Or if you've been out working in the yard, and so people forget about that. That is a time when you're getting sun exposure too. You're sweating. And so when you sweat and you see that sunscreen coming off,
Mhm.
you have to reapply it if you're going to stay out there. Dr. Johnson, the other excuse that I've heard, and I hear this a lot in ethnic communities, is they don't like sunblock because it leaves an ashen look on the skin. They look ashy. Yeah.
Mhm, mhm,
And so they don't want to use it. And so now there are all of these great products out there where you don't get that ashen look to your
mhm,
skin. You can get
mhm,
the tinted sunscreens that go on
mhm.
like a foundation.
Right.
Those are very nice. And so I think that excuse is gone, but that's one that I've heard before. They just don't want their skin to look like they've got a white
Right.
powder on their face. And no,
Yes.
that one's not good enough anymore. You've got to wear sunscreen or sunblock. And you also need to make sure you put it on 30 minutes before your sun exposure.
Mhm.
And so I have to fuss at my kids about this a lot because they want to go get on the soccer field. And as they're walking up to get on the field, they're starting to put on sunblock. Well, you need to put on your sunblock before you leave home because that's at 30 minutes before you get out there on
Mhm.
the field.
Exactly.
Yeah.
And what I tell my patients, especially when they have medical problems, like you mentioned, they had chemotherapy, but if my patients like have lupus or other medical conditions like rosacea that the sun will make it worse, I have them to practice using sunscreen, putting it on even in the spring when it's too cold to go out or it's not that sunny. And I said, get in the habit of putting it on every 2 or 3 hours. So when the sun is here, you go out, you won't think anything of it.
Yeah.
And so that's what I advocate. But and you're right, the ashy look was the sun block, the
Hmm.
titanium dioxide was
Right.
micronized now, like you said, so it's much more refined. It's still a little iridescent look now,
Yes. Yes.
but I like the sunblocks because people don't they're not they don't react to them. They're not allergic to them.
Uh-huh.
So if a person says, "Well, I had a sunblock, but I still had it broke out in a rash with it," it's because they mix a sunscreen in it. So therefore, you need to look in and see what the ingredient is, and it's usually not the titanium dioxide; it's something
It's
else
usually
they're
not
using. hmm
right. Like a
and the
fragrance or
sunscreen,
something.
yeah, exactly.
Yeah.
So so that's still not an excuse, like we mentioned. But right then, well, I think we have, and we talked about the clothing, like you said, clothing. There are some that actually have some protective factors, and they protect about SPF of 8. And they're stylish. I mean, I got a hat once, and it was really beautiful. I like my hat. So there's some really nice things out
Yeah.
there that if people don't want to put the
Yeah.
sunscreen on for whatever reason, you can definitely cover the areas up.
You can.
Okay.
But
Yeah.
definitely you need that SPF 30 or higher. I wouldn't go
Mhm.
any lower than 30. What do you usually tell patients?
I do. For my ethnic skin, I tell them you can get down to 15. That's so common and fine anyway. But yes, 30 is actually ideal. And it's just the percentage for 30 is actually covered blocking the sun by 93%.
97%.
Mhm.
Yeah.
So, and with that, so it's really fine to use. And so that's good enough as long as they just put it on more often.
Yeah.
Okay.
Absolutely.
Let's see. We have some people here that ask a question.
Oh, great.
So yes, and I want to say, is it Allie? What should we look for with skin cancer and ethnic skin, and are new most concerning?
Yeah.
That's somebody see. You want to answer that one?
Yeah, and so Dr. Sonya has covered a good bit of this. So we talked about anything that is new. And so if you see a mole and you think to yourself, what is that? Or
Mm-hmm.
if a significant other sees something and they say, what is that? Because very often there are areas that we simply cannot see. So a new mole, a mole that is changing. So maybe it's changing in color, maybe it's changing in shape, maybe it's a mole that's bleeding that, previously you didn't have that problem. And then there's the whole ugly duckling that we talked about. Sometimes, especially in ethnic skin, you will have clusters of moles.
Mm-hmm.
And within that cluster of moles, if you see something that stands out, it doesn't look quite like the rest, then that's a mole that you may need to see your doctor about.
Right, right. And then thank you very much for that question. And then another question that came in um, by, let's see, how long is too long in the sun? Ah, good
So,
question.
that's a really great question. So, lots of times people are concerned about how much vitamin D they need. And so, um, I think that we really overestimate how much time we need to be outside to have adequate vitamin D levels. So, the best way actually to get your vitamin D is from your diet. So, oily fishes like salmon and sardines, mackerel, herring, tuna, if you're not getting those things, then it's perfectly fine to do supplements. I don't think that there is any prescribed amount of time that somebody says, oh, I need to have this amount of time in the
Mhm.
sun. In fact, probably the amount of time that we get in the sun passively is more than enough. And so, what I mean by that is, driving to work this morning, I bet all of us got as much sun as we probably really needed. And I'm very cautious in how I answer this question because sometimes people will take it as, well, I got to get my 5 hours in the sun for my vitamin D levels. You don't need that long. It really is, passive amounts of sun are more than adequate. I don't think anybody, even with this quarantine, hopefully nobody is staying shut up in the house and getting absolutely no sunlight.
Right.
Sitting in front of the window like I'm doing now is getting me some sunlight, like Dr. Sonia's doing. What do you
Yeah.
usually tell your patients, Dr. Johnson?
I tell my patients, well, I haven't had that excuse as the reason why they need to go in the sun for vitamin D. But, for ethnic skin for women over 35, that is an issue that their vitamin D levels are low. So definitely, just like you said, passively, going to the car, going to the store, whatever you're doing, that is usually enough to make vitamin D.
Mm-hmm.
But you can definitely get it in your diet. But, just even go for a walk. Even if you go after 3 o'clock, it's still a lot of sun. It's just not,
Mm-hmm.
it's not the more intense sunlight. So you definitely would get enough vitamin D just by your passively just going about your business and taking, doing your daily life activities.
Right.
So, but to go and say, I need to go sit out on the porch and just soak up all the sun, no, you don't have to do that.
Right.
So,
Right.
but I haven't had that question. So that's a very good question. That thank you for our audience that
Yeah,
who
great
posed
question.
that question. Yes, that was. But anything else you would think our audience need to know?
Hey, make sure that you are talking to your doctor. I think this goes for every situation. Your doctor is there to have a relationship. And
Yes.
so when I see people who say, gosh, I've had this thing for a year and I forgot to tell my doctor about it, or I just didn't feel comfortable talking about it, that's just not the way the patient doctor relationship is supposed to go. And so if there's something you're uncomfortable with, your doctor is never going to ridicule you for asking about it. They're not going to make you feel silly for asking about it. If it concerns you or your family member, just talk to your doctor.
Yes, and I agree with you wholeheartedly. And then below on the crawler, you can see how you can follow Dr. Katisha. And so definitely on Facebook. So keep that in mind. And also, her book is called Journey. And so if you want to purchase her book, which she does talk about some skin cancers, definitely you can purchase her book on below. And so, but thank you again, Dr. Katisha, for joining me
Thank you
today.
so much. And check out my website. It's drkatisha.com, and I've got lots of information blogged there as well. Dr. Sonya, thank you so much for having me. This has been so much fun.
Yes, it has. And I think we did a great job in
Yeah.
giving some little tips, that everybody can
That's
use
right. That's
to be
right.
ready for the
That's right.
summertime. Okay, well, thank you,
We are
audience, for
ready for the
joining us.
summer.
Yes,
Thanks.
yes. So you're very well prepared for the summer once we can get out there and really enjoy ourselves. And you take care. Again, I'm your host, Dr. Sonya Johnson. I'm a board certified dermatologist, creator of the Gorgeous RX system, as well as a Amazon bestseller. I have women who want to have even and clear skin tone with increased confidence. If you have any questions, again, you can go to, like Dr. Katisha said, her website. There's information below concerning her book. And thank you again, Dr. Katisha, for joining me. I do appreciate you. Take
My
care.
pleasure. Have a great night.
You too. Take care, everyone.
Thanks.
Okay.